On today's show, we're talking all things skincare, and I'm so excited to be joined by board-certified dermatologist Dr. Martha Arroyo. The Yale and Stanford educated physician has an MD and a PhD. She's here to offer some practical tools to help you put your best face forward. Welcome to How to Stay Sane with Karen Jordan. How to stay sane. We're so pleased to be joined with Dr. Martha Arroyo. Thank you for being on the show today.
Thank you for inviting me, Karen. It's a pleasure.
Full disclosure, everyone. Martha and I were roommates at Stanford, so we know each other very well.
Very well, and for a long time, and it's been so wonderful.
Yes, it has been wonderful. I'm so happy. So first of all, let's get started. This is the time of year when people are out on the beach in their bikinis, really concerned about their skin because they're showing it off. So are there I know everybody knows they should wear sunscreen, but can you talk a little bit about when sunscreen should be applied, what SPF people should look for, and how often it should be applied when they're out having fun in the sun?
Absolutely. So I always tell my patients when the weather is nicer and they're outdoors enjoying themselves to apply sunscreen. And usually the recommendation is SPF 30 or higher. We usually recommend application 20 minutes prior to going out into the sun, and then reapplication every 2 hours, or immediately after sweating or swimming, because sweating and being in the water, like pool water or ocean water, can actually remove a significant amount of the sunscreen. So those are the recommendations from the American Academy of Dermatology, and that's what we recommend to our patients.
Excellent. And not only are people outside this time of year, but just in general, a lot of people are noticing maybe changes in the condition of their skin. Are there things like stress that can impact the skin? And if so, how does stress affect one's skin?
So the biggest stressor that people have on their skin is the sun. So the more sunlight people get without protection, the more aging you can see in the skin. Other stressors include pollution, which if you're in a major metropolitan area can be a significant problem, and also different skin diseases that can stress the skin out, like eczema and psoriasis. So all of those things can affect the skin. And in terms of protecting it, the sunscreen we already talked about, people also can use antioxidants, both applied topically like vitamin C, or taken orally to protect the skin as well, and to protect in general the body from all of the different exposures they have. But the skin is definitely in contact with a lot of different environmental exposures and different stressors. So the skin is one of the most important things you can protect.
So SPF is key, obviously. I've also seen, are there products now that even come with environmental protections in them besides SPF? Is that something that people should look out for?
Yes, so there are lots of products, a lot of products that contain antioxidants. So looking for those in your products, making sure you're looking for a product, a sunscreen that says broad spectrum. That's your number one listing that you want to look for. And there are different types of sun protection. There are mineral-based sunscreens. There are filter or UV filter-based sunscreens. Mm-hmm. So there's also sun protective clothing that can be used to protect the skin from the sun and the environment. And that's available, for in long sleeve and short sleeve, but it's a great option to sunscreens in general.
That is a great idea. I should probably invest in that. Looking for a quick, fun read this summer? Pick up my book, What She Says, Words of Wisdom from My Southern Grandmother. It's filled with heartfelt, insightful, and some humorous quotes from my maternal grandmother, Emma Crawford. Her thought-provoking quips and old-school wisdom cover everything from relationships to how to handle stress. Order your copy of What She Says, Words of Wisdom from My Southern Grandmother on Amazon. Now back to the show. Are there certain skin conditions that are connected to, for example, mental health issues that people should be aware of?
There are some skin conditions that are found with mental issues.
Mm-hmm.
So, for example, delusions of parasitosis. There's also what we call picker's nodules, which are due to often anxiety and people picking on a certain part of their skin. So some of these conditions are more a manifestation of the psychological problems that are going on. But also a lot of skin conditions can cause people to have anxiety and have concerns, and things like psoriasis and eczema, for example, especially in young people, can cause them to have be shy about their skin, not want to expose it. So treating those conditions also is helpful for helping those people through those psychological issues.
I see. That's very interesting. Is there, a lot of people talk about skincare routines these days, and there's so many videos on YouTube and on TikTok, et cetera, about skincare. Is a skincare routine an example of self-care? Is it something that's suggested?
So I do think that a skin routine is an example of self-care. I think anytime you do any kind of routine, whether it's brushing your teeth, taking care of your skin, taking care of your hair, it's all something that's personal, and it's important to take care of yourself. In addition to doing all the things we have to do, it is important to take that time out and take care of our bodies. And it varies from person to person. And as you know, there are many different types of people with different types of hair, different types of skin, and all of that affects what the best option is for treatment and how to take care of your skin. For me, honestly, and for my patients, I always say the simplest routine is the best routine, because you're more likely to stick to it, you're more likely to follow it for the rest of your life. And so depending on your skin type, whether you're oily, dry, or combination, whether you have other conditions like eczema, for example, a person who's oily and has no eczema would have a different skin routine than someone who's dry and has eczema. So also in that brief teenage year period where we all have acne, that time period is also very different in terms of what you're going to use for a skincare routine. But I definitely think simple is easier for people to remember, and definitely there's been enough data in the literature to suggest that washing your face twice a day at a minimum is important. Moisturizing, especially if you are not a person who has a lot of oil on their skin, and then modifying it based on your skin type is really the main thing. And then going back to sunscreen in the mornings and making sure you're protecting your skin from the exposures of sun, which age you and can cause discoloration and cause a lot of different things.
What about toner, for example? I know a lot of people, so you're saying basically it's not necessary to have what I've seen some people do, which is have a 10-step skincare routine. So that's not necessary, right?
So there is no place where it's necessary to have 10 steps. Of course, some people may need 10 steps, depending on if they have acne, if they don't have acne, etc. But there's no specific recommendation that 10 steps makes things better. I think it should be personalized to every patient. Every person should be able to have their own specialized routine, and also depending on what they need. So it may be a 3-ingredient or 3-product routine for one person. It may be a 5-6 product routine for another. But I think that, especially in this time of social media, there is a lot of hype for people doing a lot. And sometimes simple is actually better. But again, if you put a moisturizer on top of a moisturizer, is that going to hurt anybody? No. But I think people have to feel comfortable. Also, there's only so many hours in a day that people can do a routine. So having, a busy mother or busy executive isn't going to be able to do 10 steps, every day. So it really should be tailored to the person, to the patient.
I see. Well, that makes sense. What about when it comes to anti-aging? Are there particular recommendations that you have for people who are concerned about their wrinkles or preventing wrinkles?
Absolutely. I think the number one thing is to start at a young age. A lot of people start thinking about the wrinkles once they see them. And the most important thing is to start thinking about them before they happen. So taking care of your skin when you're young, wearing sunscreen in your 20s and 30s, protecting it when you're a child. So a lot of parents out there, I encourage them to make sure they protect their children's skin. But wearing your sunscreen at a young age, starting in your 20s, at least once you're actually able to do things for yourself, as a teenager, 20s, wearing products or using products in the evenings that have anti-aging effects, things like retinols, tretinoin, vitamin C's have shown antioxidant activities and are anti-aging. So there are lots of different products that are out there, but probably the ones that have the most information about them or literature about them are the tretinoins and retinols.
So basically, start using those before you see the wrinkles, or when you start seeing some wrinkles?
Well, a lot of people will start them in their teenage years for acne. So continuing those into your 20s and 30s and beyond is probably a good habit. It all depends also on your skin type. So some people are very sensitive to these types of topical tretinoin and retinol products. So there are other newer products out there that have similar effects, but maybe not as studied and maybe not as dramatic. There are more and more products out there that have some benefits, but maybe not as dramatic.
I see. And do you think having just a skincare routine in general, whether it's 3 steps, 10, whatever people prefer, do you think that can also, we talked about it acting as a self-care method, do you think it could also be like a form of mindfulness for people, or to just sort of help them?
Yes, I do. I think that's a good point, Karen. I think that taking that time away, taking that time for yourself, whatever minutes it's going to take, whether it's 5 minutes for a short routine or 10, 15 minutes for a longer routine, I think that time spent sort of concentrating on yourself and using that kind of meditate even is a time spent well with yourself. So giving yourself that 15 minutes of me time is important. Whether you're a mom busy with kids, or someone who's working, or someone who's older and just needs to be able to focus on themselves once in a while. I think that time period is very important, and I think it can be really made to, encompass that self-renewal that you're talking about.
That's great. Is there anything else that we've left out that you think people should be aware of or should know about?
Yeah, I think that an important point that should be stressed is that our skin goes through many changes. We have our skin when we're young and it's beautiful, it's amazing, right? And we don't have to do much to it. And then we start to age, we go through our 20s and 30s, and then we get into our 50s, 60s, and 70s. And they're all along the way, our skin does change. And we sometimes have to change our routines with that too. So I think that's important for us to remember and to take that into account when we're planning our routine.
I think that's excellent advice. Thank you so much for your time, Dr. Arroyo.
Oh, thank you very much for inviting me, Karen. And we're all very proud of Karen for doing such a great job on all her work, and especially this podcast.
Thank you. Well,
you're welcome.
We may have to do a part 2 in the future, but thank you so much for your time today, because I know it's going to help a lot of people.
Well, you're absolutely welcome, and I'm available anytime you need it.
I'm so grateful for all the wonderful insight that Dr. Martha Arroyo shared on today's show. And if you're not already subscribed, make sure to subscribe to this channel so you don't miss any upcoming episodes. Thank you so much for listening. Join us next time on How to Stay Sane with Karen Jordan. How to stay